provide his expertise today, and we're really looking forward to hear what he will share. So thank you, Tom. You can share your screen, and we'll be around to answer questions in the chat and the Q&A.
Just give me 1 second. Of course, I have to find it now. Oh, it's missing, of course. Sorry, everybody. I will have this up in a second. Of course, I can't find it. There it is. Okay. Please tell me. I'm hoping everyone can see that. Good afternoon, everybody. My name is Tom Giordano. As Talia said, Talia, thank you. Faith, thank you. Gift of Life, thank you. I'm a disability attorney. I know I manage day-to-day operations in my firm, but my true passion and my heart is in helping people who are disabled receive Social Security, disability, and supplemental security income benefits. I've been doing this for almost 18, 19 years now. Helped probably upwards of 50,000 individuals in all 50 states receive benefits. So fairly knowledgeable on the topic, although I will say this is not intended to substitute a lawyer or advice. And if you have a lawyer, I would strongly suggest that you listen to him or her. Really what I wanted to do today is I wanted the individuals on this call, so to speak, to have an understanding of what disability benefits are available to you, whether you've had a transplant or whether you have medical conditions that may lead to a transplant eventually. Just want you to understand what your rights are. I want you to know what benefits are out there for you. And hopefully what I can accomplish by the end of this presentation, and I promise you it won't be too long, it's that you feel comfortable understanding what's out there for you, and of course know that you have some options. I think sometimes when I deal with individuals, they're calling my office because they're at the worst point of their life, right? They're out of work, have medical conditions, you may have just had a transplant, you may be waiting for a transplant, you're stressed out, you don't know what's going to happen, you can't tell what the future holds, and you want to know what benefits are available, and hopefully today's program will help you there. So let's get right into it. I think the best way to handle this is I'm not going to look at your questions during this. I'll probably get too distracted, but we'll be happy after the presentation is over to try to answer as many questions as possible. If I don't get to all of your questions, I'll make sure that Faith or Talia sends me some emails, and I'll be happy to answer as many as I can. So let's talk about the basic programs, okay? There's two, and I think a lot of people get these two mixed up. Some people will call the program SSI, and some people will call the program SSD. But there's two types of benefits under the Social Security Disability Program, and that is SSDI, Social Security Disability Insurance, and Supplemental Security Income, or SSI. Two systems that share similar characteristics, but have very different requirements for who is eligible, okay? So let's start with the first one, and that's SSDI. Now that's a program that's designed for individuals who have worked and paid into the system. So if you've worked and you've paid taxes, you've looked at your paycheck and you see this FICA tax, FICA, and you're like, what the heck is this FICA tax? Why are they taking 6.2% out of my paycheck every week or every 2 weeks? What they're doing is they're taking that money out and they're putting it into the Social Security Trust Fund. And that Social Security Trust Fund is funding two things. It's funding Social Security retirement, which I'm sure many of you are familiar with, that at 62 or at 66 or at 70, you can retire and start getting benefits. But it's also funding a disability fund. Okay, so if you worked and paid into the system, you're eligible to collect. Now you can receive benefits based upon how much you've paid in, up to about $3,400 a month. Does that mean you're automatically going to get that much? Absolutely not. It's all based mathematically on what you've paid in, but that's essentially the max. The average individual in this country, I think, gets around $1,100 or $1,200 a month in benefits. But again, it's all based upon what you paid in. Now, if you want to know exactly what you're entitled to, there's something called an earning statement. Now, for those of you who are older than 30, you know that many years ago, the Social Security Administration would mail you once a year, right around your birthday, this 2 or 3 page document called an earnings statement. And it would tell you exactly what you would receive when you were 62 or 66 when you retired, but it would also tell you what you would receive if you're disabled. Now you have to go online. You have to go online to www.ssa.gov, and you have to click my earnings statement or my Social Security statement. And you have to answer some personal questions. You can download the statement and you can find out exactly how much you're entitled to in disability benefits. So what SSDI gives you are monthly benefits if you paid into the system, but your children may also receive benefits if you're found disabled. So I'll give you a perfect example. Let's say you're a 42-year-old individual who was found disabled. You have 2 children under the age of 18. You will receive what your benefit is, and they will receive roughly half of what you are getting in addition to what you're receiving. And the reason why the government lets your children receive benefits is they realize that even though your children aren't disabled, it costs extra money to have kids, right? A family costs money. So you just having what you get is not going to be enough. They give you a little extra to cover your children, and they receive those benefits up until they're 18. You also receive Medicare. So if you're under the SSDI system and you're found disabled, 24 months after your date of disability, you will receive a Medicare card. Now, the only other way to receive a Medicare card in this country is to turn the age of 65. When you turn 65, you become Medicare eligible. You also can become Medicare eligible at a much earlier age if you're found disabled under the SSDI system. SSI is completely different. Although they both use the same medical definitions to determine whether you're disabled, SSI is based for individuals who never worked, for children, people who have worked maybe under the table, not paying taxes, or those who are at the welfare level, essentially receiving public assistance through the government. So if you have limited income and you have limited resources, you can qualify for SSI, even if you haven't paid into the system for SSDI. So it's based upon financial need and not your work history. Now, the most money an individual can get in 2023 under SSI is $914 a month, or if you're married and you're a couple and you're disabled, $1,371. You don't receive Medicare under SSI, you immediately receive Medicaid. So a little bit of a different insurance, although still a good one, and you don't have to wait 24 months. But under the SSDI system, you do. So the key differences, as I've already acknowledged, is when you're under the SSDI system, you have a work history that's required. You get paid based upon your earnings. SSI, no work history, benefits based upon financial need. Some individuals can qualify for both. And the good news is when you apply for disability, they're going to tell you, the Social Security Administration is going to tell you whether you qualify for SSDI or SSI or both. So you don't have to worry about it too much. Let's dig in to the eligibility criteria for SSDI. There's all kinds of calculations that we are not going to talk about today. The easiest way for me to tell you if you're eligible, if you've amassed enough credits to apply for SSDI, if you paid enough taxes to apply for SSDI, is that you've essentially worked and paid taxes 5 out of the last 10 years. So if you're an individual on this call today and you've worked and paid into the system 5 out of the last 10 years, you're most likely eligible. If you're younger and you haven't even had an ability to work 10 years yet, you don't have to work 5 out of 10. It's a much different calculus. Regardless, the easy rule of thumb, if you paid into the system 5 out of the last 10 years, you're going to qualify for SSDI. Now, determining which system you're in is step one, but step two is the sequential process. Each of these programs, you go through the same 5 steps. We're going to cover those 5 steps in a minute. But once you're found out which kind of system you're in, whether you're SSDI or SSI, then they have to evaluate you under the 5-step sequential process. SSI, much different, as I alluded to earlier. You really have to have very few assets. In fact, if you're single, you have to have less than $2,000. And if you're married, you have to have less than $3,000. So for example, if you're single and you have $10,000 in the bank account. Maybe your poor Aunt Edna, she left you some money in her will, and you have some money in an account, and it's over $2,000. You don't qualify. Even if you have no other money or income, if you have over $2,000 in assets, or $3,000 if you're married, you're not eligible. Now, the Social Security Administration is not going to count the kind of the value of your home. Or if you have one car, they're not going to say, well, your car is worth $3,000, so you're not eligible. But if you have a second car or a second house, they're going to count that against you. And of course, you also have to have very little income from any source. And I put that here in the presentation. And by the way, I'm happy to forward this presentation to whoever wants it. Again, it's not a perfect presentation in terms of facts, but it's enough, like I said, just to give you some general thoughts here. But the government counts almost everything it can as income, including help you may be getting that's not in cash. So even if you live with a friend rent-free, they may actually count that against you. But again, once they decide if you've qualified under SSI or SSDI, you have to go through the 5-step sequential process. And this is where we're really going to spend most of our time, okay? Because this is really where the rubber meets the road in terms of being found disabled under the Social Security definition, whether it's SSI or SSDI. So there's 5 steps, and you typically have to pass the first step to get to the second step, to get to the third step, to get to the fourth, to get to the fifth. And I'll explain each one in some detail, but I'm going to, for the purposes of this presentation, for the purposes of all the individuals out there who have either had a transplant or maybe in line for a transplant, I'm really going to focus on step 3. But we'll talk about all 5 very briefly. But step 3 is really the most important one for transplant recipients and those individuals who may have received transplants. So step 1, are you working at a substantial gainful level? Now, in 2023, the Social Security Administration puts the substantial gainful number at $1,470 per month. So that means if you are currently working and making over $1,470 per month in work earnings, you cannot apply for disability because you're not going to pass step 1. So step 1 is, are you working and making more than $1,470 a month? That's gross, by the way. That's before taxes. So if you're currently working and even if you're a transplant recipient and you're currently working, you cannot qualify for disability benefits because you can't pass step 1. So most individuals who contact my office, most individuals who I help, are either out of work completely or their conditions are such that they can't work much at all and they're earning less than $1,470 a month. Now, if you're currently working and making more than $1,470 a month, and let's say 6 months from now you stop working, well, then you can apply at that point immediately. But you can't, you can apply, but it's not going to really go anywhere. So I don't want to discourage anyone from applying. But if you're making more than $1,470 a month, you are not going to get past step 1. So let's assume you get past step 1, and most people who call my office do. Step 2 is, do you have a severe impairment? Now, if you're on this call, I'm going to say, without knowing all of your situations individually, you probably have a severe impairment. The good news about step 2, it's a pretty easy step to overcome. The reason why they added that step there is they didn't want people who have medical conditions that are probably going to heal or be better within 12 months to apply. So for example, if you broke your ankle, that's a nasty injury. It can hurt like heck, but it's not necessarily going to keep you out of work for 12 months or longer. So that's going to disqualify you. If you applied for disability, you're out of work because you broke your ankle, you're probably going to lose because you can't get past that severe impairment part. But for the purposes of this presentation, I'm going to assume most of the individuals who are either listening or who are listening for someone else in their family, you're going to get past step 2. Step 3. Step 3 is the hardest step to actually get approved at. This is the only step that if the answer is yes, you meet the definition of the Social Security's listings, you actually win. You only have to go to step 4 or 5. So step 3 is this great step in the middle that says if you can qualify under SSA's definition for your medical condition, you automatically win. 9 out of 10 times I tell my clients, we're not going to win at this step. But for this presentation, for the people on this call, I think this is where you will win or where you can win. And we'll go over that in a second, I promise. But let's assume you're not a transplant recipient. Most individuals applying for disability are not going to meet or equal a listing at step 3. So step 4 becomes, can you do the work you've done in the past? And what Social Security does is they look at your last 15 years of work and they say, okay, my last 15 years of work, I've been an attorney. They'll say, Tom, with your broken ankle, can you do the work you've done in the past? The answer is yes. I'm fortunate that if I have something wrong with my legs, I can still do my job sitting at my desk, talking, thinking, et cetera, et cetera. So I'm going to lose my case because I can do the work I've done in the past. Now, I have been a lot of individuals I help are blue collar individuals, people who work very physical jobs. They hurt their back, they hurt their spine, they hurt their knees, they hurt their shoulders. They typically can't do the work they've done in the past, or else they would be doing it, right? So they usually get past step 4. Step 5 is where it gets very difficult. That's where a majority of individuals in this country get denied. So you prove to the Social Security Administration that you're out of work or you're making less than $1470, so you get past step 1. You prove to them that you have a severe impairment, you get past step 2. You don't meet or equal the special listing, so you get past step 3. You prove you can't do your physical work in the past, so you get past step 4. But step 5 says, okay, Tom, well, you're a lawyer. You may not be able to be a lawyer, but could you say hello to somebody walking in the Walmart? That's called a greeter. Can you be a greeter? Well, if I had a physical condition that made it difficult for me to do certain things, but I can still speak and I can still say hello to people, I might get denied at step 5 because I can do something else. Doesn't matter if it's the type of job I've done in the past. It doesn't matter at all. It doesn't matter how much money I was making in the past and how much money the Walmart job would give me. They don't care about that. Just want to know, can you physically or mentally do the job that might be available in the national economy? So that's a difficult step to overcome. We certainly do a lot, overcome it a lot, but that's usually where people get denied. But again, I keep going back to it for the purposes of this presentation, for the purposes of individuals who are transplant recipients. Step 3 is where you're going to win. And I'm going to go to my next slide here, which is a very important slide. Now, before I talk about these specific sections, I want you to picture a big book, a book that has 50,000 pages in it. And it has every medical condition under the sun in that page. And there's specific things for each medical condition. Social Security says that if your medical condition specifically meets one of these in our section, you can win automatically. Now, for transplant recipients, you are going to be automatically found disabled in certain circumstances. So under section 3.00, which is all of our respiratory disorders, okay, there is a section 3.11, and that's for lung transplantation. Now, if you have had a lung transplanted, you're considered under a disability for 3 years from the date of your transplant. And after that, they'll evaluate to see if you have any residual impairments. So that's an automatic win if you meet or equal that criteria. Heart transplant, automatically considered disabled for 1 year following a heart transplant. And then your eligibility is reviewed after 1 year based upon whether you have residual symptoms or complications. Liver is the same way under section 5.09. Automatically considered disabled for 1 year following the transplant. Kidney transplant under 6.04. Automatically considered disabled for 1 year following that. Bone marrow or stem cell transplantation under 7.17. Automatically considered disabled for 1 year following that transplant. So this is extremely important. This means, and nothing's easy when it comes to Social Security, okay? But they understand, the administration understands just how serious a transplant is, just how medically significant that is. So you don't have to jump through hoops to prove disability. If you've had the transplant, you have the medical record showing that, you're going to get it for at least a year. Now, the question becomes, well, why a year? Well, they assume that there's going to be a year period where your body is clearly going to have to adjust to the transplant. Obviously, make sure it takes and there's no other issues with it, but then see if there's any residual symptoms or complications. Because if obviously if a heart transplant is successful, that's great, but there may be some residual issues to that heart transplant, right? Let's just use fatigue as one of them. So they will review you after a year. And if you have symptoms or complications that make it difficult for you to work and sustain work, you're going to keep your benefits. But what I love about this is it's an automatic, right? And now what's important for anybody who's listening on behalf of a child, the children have their own listings. Now their listings, I actually gave you the corresponding listing to each one in italics and in parentheses next to it. So the heart transplant for adults is section 4.09. The heart transplant for children is section 104.09. Now, the good news here is once Social Security sees your records and they see you've had a transplant, it should be as easy as giving you the benefits, finding you disabled at that point. Now, what if you have not had the transplant yet? What if, for example, you're having issues with your kidneys, you're not at the point yet where you need a kidney transplant, but it may be coming? Well, you could still meet or equal listings because there are specific listings that don't just address transplants. So nephrotic syndrome, chronic kidney disease with dialysis. So there's different sections here that you can actually meet or equal if you have not had a transplant yet. And this goes for every one of those previous transplant listings that I showed you. There's extra listings for heart. There's listings for kidneys. There's listings for issues with your respiratory system. So you don't necessarily just have to have a transplant. Obviously, that was important for us to discuss today because that's what we're dealing with, the gift of life. But I wanted you to know that for any friends or family or anybody who's thinking about this. Well, I didn't have a transplant. Can I meet a listing? The answer is absolutely yes. For me to have shown you all the listings would have taken us hours. I mean, there's literally, the spine has 15 different listings. We could have gone through every body system and I could have shown you listings. But if you ever are just curious, Google Social Security listings 6.00, then you'll see all the ones under the 6.00 or the heart or et cetera, et cetera. Let's talk about compassionate allowances for a second. So the Social Security application process is unfortunately long. It's gotten much better post-COVID, believe it or not. It's one of the strange things. Most organizations really went backwards in terms of processes because of we weren't ready for the pandemic. Well, for some reason, since the pandemic, the wait times of Social Security have gotten better. I think because it's less people going to offices, more people working from home. Whatever the reasons are, it's gotten shorter to go through the process, but it's still a process. But if you've had a heart transplant, or you were 1A and status 1A or 1B on the transplant wait list for your heart, you can meet a compassionate allowance. Instead of waiting maybe 6 months to get an answer, you may get an answer in 3-4 weeks, maybe even sooner. That's a compassionate allowance. There's another one for transplant coronary artery issues with CAV. Okay, so if you have CAV, automatically like this, well, I say like this, I shouldn't have said that. I shouldn't say it that way. Much quicker than the general process, which I'm going to talk about in a second. Unfortunately, these are really the only two transplant-related compassionate allowances. A lot of the compassionate allowances focus on very rare forms of cancer and some other serious medical conditions like ALS or Lou Gehrig's disease. It's just a reduced waiting time, faster application processing time. and it's a priority status for disability determination. This is, again, not for everybody, but I wanted to make sure we talked about it. So let's talk about the application process. If you're curious about it, or maybe you're going through it now, let me explain it to you as quickly and efficiently as I can. You must apply for disability benefits. There's really 3 ways to do that. You could do it in a Social Security Administration office. So most towns have a local office, probably within 10 miles of where you live. That's one. Number 2 is you could do it online. You can do it yourself online, ssa.gov, start an application. Number 3 is you can hire an attorney. And by the way, today's a 100% educational presentation. This is not to sell the attorney services, or especially my services, but what I will certainly tell you, being as objective as I possibly can, is yes, you can apply on your own. Yes, you can apply down in the Social Security office. And if you're an organized individual who has all your medical records and all your doctor's information, you could be fine. I would suggest to you, though, that consider an attorney to help you apply, just so they do it right. But like everything else in life, make sure you go to a disability specialist. You don't want to go to somebody who dabbles in this. You want to go to somebody who spends 100% of their time doing it. And I can assure you, because I've been all around the country, there are excellent disability attorneys in every single state. And we'll talk about ways to find them at the end of this presentation as a resource. But you have to apply. And the best thing I can tell you, the best tip I can give you for a successful application, and I'm skipping ahead a little bit, is the importance of letting the Social Security Administration know all of the doctors you're seeing. So if you came to my office and we talked, or we did this over the phone, and we talked about your application, the most important information I'm going to need from you is who are the doctors you've treated with over the last 1 to 2 years. I'm going to put those into your application, and Social Security is going to order their medical records. If you fail to include a doctor, Social Security will fail to receive those records, and therefore that doctor's treatment will almost pretend like it didn't exist. So that's why it is so important that you make sure all of your doctors are listed. I also would tell you to communicate with your healthcare providers. Let them know you're applying for disability. Not so much that you're getting their opinion on whether or not you're disabled, because sometimes doctors don't really know the definitions of disability as the Social Security Administration lays it out, but more so that their office is aware that, guess what, the administration is going to be asking for my records. Please provide them in a timely manner. It's extremely important. Well, let's go back to the application process for a second. So you're going to apply for disability. The application should take, depending on how much information you put in there, an hour, maybe a little less. Once you've applied, then the next step is Social Security starts gathering all of your medical records. This process can take a little bit of time. We on average see an answer on the application within 4 to 6 months. Now, for a lot of people, that is a really long time. That's 4 to 6 months without benefits. 4 to 6 months you're not working. It's a scary proposition. Unfortunately, there's not many ways around that. However, if you're a transplant recipient, I would suggest to you that you'll probably get a quicker answer than a person maybe who is applying just for herniated discs in their back or severe arthritis in their knees. If you're denied, and I will say this until I am blue in the face, if you are denied, appeal. Don't throw your hands up. Don't stop. Don't get frustrated. Don't start over. Appeal. From the time you get denied, you have 60 days. The date on that letter, it's actually 65 days to file an appeal. Appeal, appeal, appeal. 70% of first-time applicants get denied. There's a lot of reasons for that. Again, I think transplant recipients probably have a much, much lower denial rate than that. People who are in line for a transplant probably have a much lower denial rate than that. Doesn't mean they don't get denied. You don't give up, you appeal it. What happens is it goes to a reconsideration. The reconsideration is the second stage. Another set of Social Security trained eyes look at it. Usually that reconsideration decision is denied again. So now you've been denied twice. The third step is the step where I think most people have most success, and that's when you go in front of an administrative law judge. Now, this process can take up to a year. Again, another scary proposition for people. I can't wait a year without benefits. What am I supposed to do? I completely understand. And I don't have an answer all the time. And it's a very difficult conversation to have. Hopefully, because you're a transplant recipient or you're on the list for a transplant, you don't have to wait a year or longer. But that is something you just have to be aware of as a possibility. But whatever you do, never accept the first decision. Always appeal, always appeal. Typically, the people who get denied on the first or second try will win in front of a judge. Hopefully, you won't even have to get that far. Hopefully, you'll win pretty quickly without even having to go down there. Talked about this, can't say it enough. If denied, do not stop, file an appeal. If you want to apply on your own, which is something you absolutely could do, and if you get denied once and you get denied twice and you have to go in front of a judge, please don't represent yourself. That's when you really have to seek assistance from an advocate or an attorney. I would never want you to go in front of the judge without an attorney. In fact, 99% of the judges will continue the case so that you can find an attorney because they just don't want you to go in there and represent yourself. Very important. Let's talk about post-transplant benefits and reviews. So I kind of alluded on this a little bit. You saw from this slide that individuals who had a heart transplant will be considered disabled for a year and then they will be reviewed. Same thing with liver, same thing with kidney, same thing with bone marrow and stem cell, and lung was a little longer at 3. So you will be reviewed because look, there's some scenarios where you can have a transplant and have a perfect recovery and you are as good as new and you can go back to work. And trust me, if you're feeling that way, I bet you're going to want to go back to work. They're just reviewing to see if they should continue to pay you. And what they do is they just order your records from your doctors and they'll take a look at it and they'll see exactly they'll see exactly what's been going on with you post-transplant. If you are someone who is not a transplant recipient and you're under the age of 50 or 55, the average continuing disability review is about every 3 to 7 years. So you're going to be reviewed most likely at some point if you weren't a transplant recipient anyway. Again, the only thing I would say to you is you have to keep going to your doctors. If you're feeling great, great. But if you're having any issues whatsoever, you must have them documented by your doctor. It must be in the doctor's records because I don't care how compelling you are as a person, how truthful you are as a person. If complaints, symptoms, and issues are not in your medical records, they don't exist to the Social Security Administration. Very important. I will tell you this, one of the biggest misconceptions about disability is that people really want to be on disability forever. That is not true. Most of my clients are on it because they have to be on it, and they would love to get off of it. And guess what? The Social Security Administration would love to get you off of it as well. So they give you incentives, okay? Incentives to go back to work. So if you're found disabled and you want to test out whether you can work, they give you a test period. It's called the trial work period. It's a little confusing. I tried to keep it as clear as possible here. Let me give it to you in a nutshell. If you're found disabled, let's say you had a liver transplant. Been out of work for a year and a half and you feel like you want to test the waters and go back to work, but you don't want to lose your benefits because you're not sure you can even sustain work. You won't. The Social Security Administration allows you to work for up to 9 months, make as much money as you possibly want, and after 9 months, if you're back to work and it's continuing, they're going to eventually take your benefits away. Well, let's say you go back to work for 3 months, everything's great, and after the 3rd month, you're just not feeling great. Something's going wrong. You're fatigued. Their symptoms are getting worse, whatever the issue is. Get out of work and your benefits will continue. So they don't automatically take your benefits. What they do is they allow you to have a 9-month trial work period, but that's not 9 months in a row. So you can be out of work for, you can work for, let's say, 2 months in a row. Then you stop, your benefits will continue. And you go back to work for 5 months. Then you stop. Well, now you've gone back to work for 7 months. Then you go back to work for another 3 months sometime later. Now you've been over 9. So now they'll stop your benefits. So it's a 9-month out of a 60-month period. Okay, so that's important to know. And by the way, you don't trigger a trial work period if your earnings are less than $1,470 per month. So I have many of clients who are disabled, who are receiving their full benefits from Social Security, and they're working part-time, earning less than $1,470 a month, and they never trigger the period. And they continue to, they can make under $1,470 a month and get their benefits at the same time. The trial work period only gets triggered if you make $1 more than $1,470 a month. That's extremely important. So I can imagine there's a lot of questions about this. The good news is once you've exhausted your trial work period, there's an extended period of eligibility. So if you have an extended period of eligibility, what that means is, let's say you've gone over 9 months, okay, over 9 months of $1,470 a month. And after the 9th month, they're going to give you a 36-month period, consecutive period. So a 3-year period where if you earn less than $1,470 that month, you'll actually get your Social Security disability check. They'll pay you if you're under $1,470 a month. So that's for 3 years. So a little confusing. They have a trial work period, and then once that's exhausted, you go into the extended period of eligibility. People always ask me all the time, what are some resources for me? I truly think one of the best websites out there is the SSA.gov. It's the Social Security Administration's website. Really a lot of great information. Can apply for benefits on it. You could get your earnings statement, as I said earlier in the presentation. The National Organization of Social Security Claimants Representatives. I'm on the board of directors of this group. This is a group comprised of disability attorneys in all 50 states. If you go on nosscr.org, NOSCR for short, a wealth of information on disability. And they have a lawyer referral service that if you need a lawyer, they'll help you there. You can also always go to your local Social Security office if you have any questions, although I can tell you I've been in those offices a bunch of times, especially pre-pandemic. It's not a fun place to be. You can wait long periods of time. I would always have an appointment. And obviously you can always email me. I'm happy to be a resource for you anytime. I mean, I've done this presentation now. I think this is my second time. I'm happy to answer questions for you, put your mind at ease. So you can always email me. That's my personal email address. There's also additional support and resources out there. We talked a little bit. We didn't talk about the Ticket to Work program, but that's a program from the Social Security Administration that actually helps you re-enter the workforce. If you're on disability, they'll ask you if you want to be a part of it. That's completely optional if you want to. Obviously, there's health insurance coverage. We talked about Medicare and Medicaid. There's financial assistance and support programs. So if you're on disability, especially SSI, you might be able to immediately for your energy provider be eligible for LIHEAP or SNAP benefits, which are supplemental nutrition assistance programs. There's transplant support groups. Obviously, I mean, the Gift of Life can help you there more than any place. And then there's advocacy and legal support, which I talked about. There's disability attorneys and advocates. There's the NOSCR organization, which I really am a big supporter of. And there's plenty of nonprofits out there as well. So last slide. I'm sorry if I talked too fast or if I was too boring today, but really, I want you to know that you have options. And you have options under the Social Security Administration, under the Social Security disability system for benefits both financially and medically. Okay, so if you're a transplant recipient, you're someone who's on the list for a transplant, if you're someone who you think you're going to need it very shortly, there are clearly benefits out here. And as you can tell, the process isn't easy, but they do make it a little easier because they understand the significance of your issues. I think it's always important to understand the eligibility criteria, to understand if you're an SSDI or SSI, the application process, understand that, look, nothing is going to be quick when you're dealing with the government, although being a transplant recipient, I think you have a little bit of a quicker avenue. And then there's post-transplant reviews, which I think people need to understand that the administration is always looking to make sure they're not paying people who shouldn't be paid. And 9 out of 10 times, if you're out of work post-transplant, you need to be out of work. But just make sure you're speaking to your doctors about the issues you were having. I mean, I think you will do that anyway. I cannot tell you how many of my clients go into their doctor's offices and the answers to the questions are, yeah, it's the same, or I'm okay, but maybe there's something going on. I just think this is the one place where you must be completely and utterly honest. It's so important for your doctor to have truly an understanding of what you're dealing with. And if you ever apply for disability, we need your records documented. And I think the most important thing that I always try to tell people is Social Security disability is not a life sentence, okay? You could be on it for the rest of your life if you need to be, but you don't have to be. So don't be scared to apply because you don't want to be branded disabled. I promise you, nobody knows you're on disability unless you tell them. And number two, you have incentives to go back to work. So really, it's there for as long as you need it. And I know personally, and I'm sure you feel the same way, there are so many benefits to being able to work, to being around people, to have that feeling that you're not at home alone and in pain. There are just so many psychological benefits to being out in the workforce that if you can work, I'm sure you're going to want to work. And guess what? If you're on disability benefits, they give you plenty of time to try work. And then once you're on it, once you're working and you're successful, you go right off your disability benefits. But guess what? If 2 years down the line, symptoms come back, it's a little easier road to reapply in the future. So you can always reapply. You always can reapply if you get taken off. So that's it. That's kind of where I wanted to stop. And the reason why I wanted to give you just enough information to feel comfortable, but clearly we can spend hours in other directions on a lot of these topics. That's it, Talia. Thank you.
That was great. There's a few people commented how wonderful it was. There's a lot of questions, and I tried to go through some of them and remove some that were answered. And as a reminder, we'll email out the recording. Tom said he would share the slides. So some of your questions might have gotten answered and you can rewatch to see. So I'm going to try my best to get through as many of these as possible. So this is what this was asked a few times, and I know you covered it, but I'm just going to bring it up again for everyone. If you're on SSDI or SSI, you can still work, correct? But only up to a certain extent.
Yeah, so the trial work period really only focuses on SSDI. So if you're working on SSI, so the most you can get, let's say, is $900 a month in SSI. If you're working and you're making more than $900 a month, you actually exhausted, you're not going to get any SSI. So really the working focuses on the SSDI portion of it. Yeah.
Okay. And then how does this relate to like if you're over 65?
Yeah, it's a good question. So SSI, there's really no age requirement. You could be 70 and apply for SSI if you meet the eligibility. But SSDI, if you're over your full retirement age, and most people's full retirement age now, Talia, is probably 66, 67. So if you're older than 66, 67, they're just going to tell you to take your retirement because it's the same amount of money that you would get if you were disabled. It's really no different. So it's at that point, you just take your full retirement. That's why there's not really an age limit, but if you're at your full retirement age and you paid into the system, they're just going to pay you your retirement benefits and not disability benefits.
Okay, got it. So someone asked if they had applied, it looks like in November of 2022 and hadn't gotten anything. Is that common?
Unfortunately, in some states it is. So there's no uniformity when it comes to how, the average I say is 4 to 6 months, but in some scenarios it's longer. What I worry about sometimes when I hear 11 months or maybe longer is something could have gotten lost in Social Security. So if you have an advocate or an attorney, you want to make sure that they're at least finding out that your case is still on track for a decision. And if you're doing this on your own, you better call Social Security ASAP and just make sure that it's still being processed. And if not, that might be the time to talk to somebody.
Okay. And if you apply in November, will there be retro pay, like when you're officially approved?
Yeah. So the one thing I didn't really get into is the date you're found disabled and how much retroactive benefits. So the one thing that you should know is the systems are a little different when it comes to retroactive benefits. If you apply for SSI, you get benefits starting the month after you applied. So if you applied June 7th, 2023 for SSI and you're awarded, your benefits are going to start July 1st of 2023. That's how retro you'll get. You'll go as far back as July. So if it takes 6 months, it'll go back to July. SSDI, I could probably spend an hour just describing this. They don't pay you the first 5 months you're out of work. Okay, so if you applied right away, you're not going to get paid for the first 5 months. But if you waited a year or so, then yes, you will get retroactive benefits to approximately 6 months from when you stopped working. And that is, I hate to give that answer because it's so specific on the date you're alleging disability from. So it's, it's different for everybody in the SSDI system. In the SSI system, it's the benefits to the month after the date you applied. That's easy.
Okay. So someone had asked about when you're doing the application, you have to list your doctors. What if two scenarios, you have a ton of doctors because of your chronic illness, and then two, if a person is hospitalized, they're seeing tons of doctors throughout their hospitalization, potentially like 100 or hundreds. Do you have to fill out every single doctor in that case, or just maybe the department?
Yeah, so that's a great question. So if they are individual doctors you are seeing outside of the hospital system, I want those listed specifically. But if you were hospitalized for an extended period of time, you just need to indicate the hospitalization. So I was hospitalized I'm in Philadelphia. So one hospital here is Thomas Jefferson University Hospital in June of 2023. That's all you need to do, because then they'll order the records from the hospital for that date of service. Dates of service are more important of when you were in the hospital, not the doctors you saw. You're seeing so many doctors, residents, this, that, and the other. Don't worry about that.
Okay. So I've worked with transplant patients for like 15 years now, and still consistently, both pre-transplant and post-transplant, hear people being denied. What do you think is the most common reason for even like a transplant patient to be denied?
Honestly, human error. I mean, the person who was reviewing the file either completely missed out on that, which I find hard to believe, or maybe the records were never ordered to begin with. I mean, honestly, there's no reason why, if you've had a transplant, there's no reason why you wouldn't even receive a short period of benefits for that 1 year, right? We just went over that in that presentation. So there's no reason for that. Pre-transplant, but obviously the significant symptomology. Again, it's just the people who are looking at the cases not understanding the medicine. The one thing that I've always joked about is when you dig into a disability file, become almost like a doctor at some point because you've seen these records all the time. But I can't always vouch for the people who are reviewing the records in Social Security. It could be somebody who's new, maybe somebody's having a bad week. I don't know, but that's why I'm so I want to scream it, like you can't accept it. You have to appeal it. Don't ever let any of your patients, people you're dealing with, ever just throw their hands up, because the right decision will eventually be made. I just don't know when.
Mm-hmm. Yeah, I was going to say, someone asked about like being in rejection and how that helps one's case. I know every transplant candidate or recipient is only that because they have a chronic illness, which would automatically make them disabled. So anyone who's going through the transplant process and then gets listed would definitely qualify. I guess the real question is how accurate or adequate are the medical records sent to Social Security, and then also the follow-up period, because some people miss their follow-up time frame and then they lose benefits.
Yeah, that absolutely happens. I mean, if you're having a good result or you're just not able to get to your doctor like you should, I mean, that could be a problem. If they're always going to assume if you haven't gone to your doctor or if the records are kind of quiet about any issues, you don't have them. So that's why I always preach, like, you know, and a lot of people will say to me in my office, well, I'm not really a complainer. Well, I understand that and I respect that, but this is the one place where you have to, if you're having issues, you have to complain about them. They have to know. For not even just for my selfish disability application reasons. The doctor just needs to know what issues you're having. So yeah, I would assume scenarios where they've stopped seeing their doctors or they're not really saying much at these visits, it's negatively impacting their case.
Yeah, and it's money that you're paying into, so it was your money at one point.
You know, again, by the way, I've had people say like, oh, I don't want a handout, and it's not a handout. Like you didn't ask for 6% of your paycheck to go into this system. It's a good system. I really like it, but it's not a handout, I promise.
So can you, I'm not sure how much you, like how much information you have on Medicare, but can you just share really quickly if you are informed about like how does Social Security then equal Medicare at some point?
Yeah, so what ends up happening is you automatically, after 24 months from the date you're found disabled. So I don't want to scare people. It's not 24 months from the time you applied, because you may allege a date of disability a year prior to the time you applied. 24 months from the time you apply, you become Medicare eligible and you receive Medicare A automatic, which is the hospital portion, right? That's free, that's automatic. There's a premium for Part B that will start getting deducted from your benefits every month. So Part B is the doctor portion of it to go to your doctor visits. And I don't even know the number right now. Shame on me, and I apologize. I want to say it's a little less than $200 a month. But the issue with this is Part A and Part B only really cover about 80% of your bills. So a lot of people will need these advantage plans that they'll have to buy separately. So you're only going to get A, and you're only going to have the option to buy B. Everything else you're going to have to do, like prescriptions, which I think is Part D, you're going to have to do that separately yourself. And there's companies that help out with this all the time.
And as far as Medicare goes, heart transplant or post-transplant, just because you're eligible for Medicare pre-transplant doesn't mean you will have Medicare forever if you're under 65.
Correct. You won't have Medicare forever, but one thing I did not put in my presentation is if you go back to work, okay, and your benefits stop, Medicare continues for up to 9 years. So you actually don't lose Medicare when you lose your disability benefit check, which is nice. So you get to keep that for a little longer.
And I believe the newest law was that, especially for kidney patients or all, I guess, recipients, the anti-rejection meds will be covered by Medicare for life.
Yeah, you know what? I should have looked up. I know I heard the same, but I didn't even look into that before I did this presentation, which I'll be happy to do if anybody has any questions on that. But I think you might be right.
Yeah, I mean, I think it's pretty recent, like in the last few years. I'm going to try to maybe one or two more questions. And again, I can send some of these to Tom also if he has any resources to share that I can send out to people. So one person asked what if I like get my transplant and then I return to work, but then I become then I have to stop because of another complication, but I lose my disability because I went to work the first time. How does that work?
Yeah, so that's common. That happens. not snap of the fingers quick, but it's a pretty quick reapplication process. You just have to, if you exhausted your trial work period and you're back to work, you can reapply. And the rules are, you don't have to go through the same potential 12 to 18 month wait period that you have to do anywhere else. So you have to reapply, but you could probably get back on quickly, especially if your doctor's records support the symptoms that you've been having post-work.
Okay. And how about someone who stops working but goes on FMLA or FMLA? So they're unpaid, but they're still technically employed. Would they be?
You can apply. You can apply the day. You can apply the day you stop working, even though you're still technically employed. You're not working for pay, so you can apply for disability benefits if you're on FMLA.
Okay. Does disability ever run out, like a lifetime cap?
No. What's great about it is if you need it that long, it goes for SSDI. Let's say you're 45 years old when you get found disabled. When you turn 66, which is your full retirement age, or 67, it automatically converts to retirement. So you just kind of take it right into your retirement. So no, it never runs out.
Okay. So someone kind of alluded to, like, I'm going to lose my Medicare post transplant at some point. Can I still reapply? And I mean, even I know that as long as you're continuously disabled by medical documentation, you can continue to apply. Okay.
Yeah, I mean, the only scenario where Medicare, you have to be worried about Medicare is if you're on disability and then you get off of it. But like I said, you have up to, I think it's 9.5 years to keep your Medicare.
There's a lot of questions. I'm trying to do my best. Okay, so do you have to be a citizen to receive SSI or SSDI?
So if you're here legally and you've paid into the system, but you're not a citizen, you can still apply because you paid taxes, right? It gets a little dicey if you're illegal and you're trying to get anything. You're not going to get SSDI, and you're likely not going to get SSI either. But if you've been in this country legally but not a U.S. citizen, you can get benefits. Yes. Okay.
So someone asked that for the compassion allowances for heart patients primarily. Someone mentioned there's certain liver patients that also qualify depending on their diagnosis for liver failure. But for a liver lung patient who is urgently ill, is their option a Terry case? Like the only option is the TERI?
Yeah, so I didn't talk about Terry cases, but critical cases like that. Yeah, the good news about Terry cases or compassionate allowance, you can always ask for it. You don't have to ask for it. They'll still consider you for it, but you can always ask for it, like consider this a Terry case. So yes, I mean, there are definitely certain scenarios where they can expedite the decision if they don't specifically meet those criteria. There's also scenarios where, again, this falls under Terry, where if you're homeless, so you don't have a place to live, and time is of the essence. There may be scenarios where you can always try to get it done faster. I've had people have some success going to their local and state representatives. So your congressperson, your senator, et cetera, they could put a letter into the file for you. I don't know. I have my theories on whether that works, but if you are desperate, I think you should try everything.
Okay. And then one more question. If you are on SSDI under retirement age, when you hit retirement age, does it just switch over? And if so, does it stay at the same amount?
Yeah, it does. It automatically switches over, and it typically stays at the same amount. However, if your retirement's a little higher, it'll go up, but it won't go down. Okay, great.
There's still a lot of questions, but it's after 4. So I will review the questions and send them to Tom as to what I feel like would be appropriate for him to answer. And I think, Tom, you said you'll do your best, but definitely give us a bit of time to pull all this stuff together. Plus, I will send out the recording as well as the slides. Again, that may take a few days. So if you don't get it until Monday, it's Wednesday now, you might not get it till Monday. So just wait until Monday before you email me. I think that's it. There's, I mean, so much participation, so many questions, so many comments about how great it was. And we're just so grateful that you've offered this, and he is volunteering his time and his expertise, which we're extremely grateful for. So thank you again for doing this again. I think this is your second, but I think your law firm has done another one for us. So this might be like the third time that you guys have done this for us. And we're just so thankful for your time. Yeah, so look out for our emails, all of the resources, and thank you everyone for participating today, and have a great day.
Take care.
Thanks, Tom.
Bye.